Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is bipolar disorder from a spiritual view. As mentioned in a previous video, from a medical view, bipolar disorder is a complex mental health condition with multiple contributing factors. It often appears in late adolescence or early adulthood. It can be caused by genetics or family history of it, brain chemistry or imbalances in neurotransmitters, brain structures that differ in patients with bipolar disorder, and environment, meaning traumatic events or high stress that can trigger episodes. The key is to keep in mind that bipolar disorder requires medical diagnosis and evidence-based treatment, including therapy and medication. Spiritual interpretation should complement, not replace, medical care. What about bipolar disorder from a spiritual view? From this lens, bipolar disorder is viewed beyond its medical definition, focusing instead on emotional, energetic, and symbolic meanings. These interpretations are not scientifically proven, but may offer insight or healing for some. Possible spiritual views include duality in conflict, meaning there is inner tension between opposites. For example, ego versus spirit, joy versus suffering, etc. Also unprocessed emotions, meaning mania might express a repressed desire or creativity, and depression might reflect guilt or suppression. Also disconnected identity, meaning feelings of not knowing one's true self, leading to identity swings. Also spiritual awakening, meaning mania might be seen as an uncontrolled spiritual awakening not yet integrated. Also energetic sensitivity, meaning bipolar people might be highly sensitive to internal and external energies. Also karmic lessons, meaning seeing bipolar as a life challenge chosen by the soul to grow in resilience, compassion, and balance. On another note, bipolarity reflects a natural duality within human nature where people naturally shift between opposites, such as action and rest, or introspection and outward engagement. Nevertheless, bipolarity becomes problematic when people lose their inner axis or sense of centeredness. This imbalance can hinder emotional regulation and make it challenging to respond appropriately to life circumstances. Without internal stability, emotional swings might become overwhelming, disrupting one's grasp on reality and inner harmony. And it is important to embrace these internal polarities as opportunities for consciousness expansion, provided emotional equilibrium is sustained. With effective emotional regulation as a strong internal anchor, people can transform these experiences into sources of creativity and personal growth. Rather than viewing such conditions solely as disorders, we can see them as complex aspects of human experience that, when well integrated, can offer us a deeper self-awareness and a richer understanding of our existence. The key is to keep in mind that these interpretations are not replacements for professional care and must be integrated responsibly. But how can we help treat bipolar disorder from the spiritual perspective? There are complementary and mindful practices or presence-based practices that can provide emotional stability when used alongside medical treatment, including meditation and breath work, observing thoughts without judgment, grounding and shadow work, conscious emotional expression such as art, dance, journaling, and energetic healing such as Reiki, prana, etc. These practices might help reduce stress and emotional reactivity, foster emotional integration and self-awareness, and manage mood fluctuations. The key is to keep in mind that complementary practices enhance well-being but are not a substitute for medications or psychotherapy. While spirituality can offer meaning and comfort, it is essential to recognize medical realities. Spirituality can help by offering meaning and purpose, emotional support and community, coping tools like prayer or yoga, but the risks are that religious delusions during manic episodes should be treated medically, not spiritually, and mislabeling manic symptoms as awakenings can delay needed treatment. The key is to keep in mind that although mental health providers are increasingly open to integrating a patient's spiritual beliefs into care, this needs to be done within a framework that acknowledges bipolar disorder as a medical condition. Takeaways from bipolar disorder include the cause from a spiritual view is an energetic imbalance, karmic lessons, identity conflict. From a medical view is genetics, brain chemistry, or environmental triggers. The purpose from a spiritual view is soul growth, awakening, polarity integration. From a medical view is mood regulation, symptom reduction, and functional living. The treatment from a spiritual view are meditation, inner work, symbolic healing. From a medical view is medication, psychotherapy, psychiatric care. Integration from a spiritual view is balancing ego-soul, light-shadow, doing-being, and from a medical view is improving stability, preventing relapses, building support systems. In summary, spiritual views can bring deep personal insights and comfort to patients with bipolar disorder. However, this disorder is a serious medical condition, and so spiritual perspectives must always work in conjunction with evidence-based treatment. May the inner peace that we cultivate today expand and guide us always. Until next time.